I'm sure everyone remembers the Democrats' Obamacare promise: if you like your health care plan, you can keep it. That promise was named PolitiFact's Lie of the Year in 2013 after it became clear that millions of Americans would not, in fact, be able to keep their health care plans. Well, Madam President, no worries about being deceived on the question of keeping your insurance this time around, because Democrats are loudly and proudly announcing their intention of getting rid of private insurance with their Medicare for All plan. At a CNN town hall in February, the junior senator from Vermont was asked, and I quote, "Will these people be able to keep their health insurance plans, their private plans, through their employers if there is a Medicare for All program that you endorse?" End quote. The senator from Vermont's answer, no. Another Democrat candidate for president, the junior senator from New York, was recently asked, and I quote, "Should ending private insurance as we know it be a Democrat goal? And do you think it's an urgent goal?" Her response, "Oh yeah, it is a goal, an urgent goal." So, Madam President, if you like your health insurance, you definitely won't be able to keep it. In fact, the employer-sponsored insurance that you have today would be illegal under the Democrats' plan. In the minds of Democrats, Americans are supposed to be enthusiastic about Medicare for All because it would give them free health care. The problem, of course, is that it won't really be free. Americans are still going to be paying for health care. They'll just be in the form of much, much higher taxes. A left-leaning think tank modeled a version of the Medicare for All plan proposed by the junior senator from Vermont and found that it would cost a staggering $32 trillion over 10 years. $32 trillion. To put that in perspective, the entire federal budget for 2019 is less than $5 trillion. That's Medicare, Medicaid, Social Security, defense spending, education spending, law enforcement, infrastructure, everything. In other words, Democrats are talking about increasing federal spending by more than 60% each year just for health care. One Medicare expert estimates that doubling the amount of individual and corporate income tax collected would not be enough to cover the costs of Medicare for All. And I don't know about my Democrat colleagues, but I don't know a lot of working families who could afford to have their tax bill literally double. And of course, this is assuming that the cost of the program would be limited to $32 trillion. The Medicare for All proposal that House Democrats released last week could substantially exceed the $32 trillion estimate because, unlike the Vermont senator's plan, it includes funding for long-term care, a notoriously expensive part of the health care system. Democrats' last attempt to have the government fund long-term care fell apart before it was even implemented because the program was not financially viable. And it's not just the cost of Medicare for All that is completely unrealistic. The timeline for implementation is as well. House Democrats' proposal would put every American on Medicare for All within 2 years. 2 years. 2 years to completely do away with health care as we know it and create an entirely new health care program to cover almost every single American. Well, Madam President, I'm sure most Americans remember the fiasco that was Obamacare implementation. The Obama administration had 3.5 years. 3.5 years to get Obamacare up and running, and they couldn't even build a working website in that amount of time. And the Obamacare exchanges were only intended to cover a tiny fraction of the number of people who would be covered under Medicare for All. The idea that the federal government could smoothly transition all Americans over to an entirely new government-run health care program in 2 years is absolutely ludicrous. And making the attempt would cause Americans an incredible amount of pain. Madam President, every aspect of this proposal would cause Americans an incredible amount of pain. There are the heavy taxes that would be required to even partially pay for this program. The bureaucracy and inefficiency that would come with any government attempt to take over health care. Then there's the rationing of care that would inevitably come along. Democrats are promising that these would be plans with generous coverage. But what happens What happens when Democrats don't have the money to pay for that coverage? Well, they can raise taxes still higher, of course, but they will also undoubtedly turn to the rationing of care that we've seen in other countries with socialized medicine. The Majority Leader noted on the floor last week that Britain's National Health Service canceled 25,000 surgeries in the first quarter of last year alone. Madam President, I could go on. I could talk about the long wait times Americans would experience under Medicare for All. I could talk about the fact that Democrats' proposal would end the prohibition on government funding for abortion, meaning that your tax dollars would go toward ending the lives of preborn babies, whether you want them to or not. I could talk about the threat that Medicare for All represents for seniors. Because, make no mistake, this program would do away with Medicare as we know it and the promises that have been made to seniors in this country. Seniors would receive care under the new plan, but it would not be the plan they signed up for, and there is no guarantee. No guarantee, Madam President, that they would receive the benefits that Democrats are promising. But if I went on about all the ways that Medicare for All is a bad idea, none of my colleagues would have a chance to speak for the rest of the day, or probably for tomorrow, for that matter either. Suffice it to say that Medicare for All would be a very bad deal for the American people. Let's hope that our colleagues across the aisle halt their mad rush toward socialism before the American people get stuck with this government-run nightmare.